Regulatory strategy. In regulatory strategy, we have 2 points. The first one is NDA and or EMEA filing regulatory strategy and the package inserts. Regulatory strategy for Claritin, as indicated, is for symptomatic relief of allergic such as high fever, urticaria, and skin allergies. For allergic rhinitis, loratadine is effective for both nasal and eye symptoms, sneezing, runny nose, itchy or burning eyes. Loratadine could be used to treat mild to moderate pain from headaches. Pharmaceutics. The drug is available as a tablet, orally suspension, and syrup, and also is in combination with pseudoephedrine. Also available as a quick dissolving tablet, which are marketed as being faster to get into someone's circulatory system, but require special handling to avoid degrading in the package. Claritin tablet contain 10 mg macronized loratadine, an antihistamine to be administered orally. It is also contain the following inactive ingredient, which is cornstarch, lactose, and magnesium stearate. Claritin syrup contains 1 mg per ml macronized loratadine, an antihistamine to be administered orally. It will also contain the following inactive ingredient: citric acid, adichate disodium, artificial flavor, glycerin, propylene glycol, sodium benzoate, sugar, and water. And the pH is ranging between 2.5 and 3.1. The Claritin tabs, loratadine rapidly disintegrating tablets, are containing 10 mg macronized loratadine, an antihistamine to be administered orally. It is disintegrates in the mouth within seconds after placement on the tongue, allowing its content to be subsequently swallowed with or without water. Claritin Radi tablets, loratadine rapidly disintegrating tablet, also contain the following inactive ingredients: citric acid, gelatin, mannitol, and mint flavor. Loratadine dosing information. Usual adult dose of loratadine for allergic rhinitis is 10 mg orally once daily. Usual adult dose of urticaria is also 10 mg orally once daily. For the pediatric dose of loratadine for allergic rhinitis is for the pediatric 2 to 5 years, 5 mg orally once a day syrup, and those who aged around 6 years old, it is 10 mg orally once daily. It's a tablet capsule and disintegrating tablets. Usual pediatric dose for urticaria for the pediatric, which is aged between 2 to 5 years, 5 mg orally once a day. It could be a syrup, and 6 years or older, 10 mg orally once daily, could be a tablet, capsule, or disintegrating tablets. Patient populations, pediatric, the pharmacokinetic profile of loratadine in children in 6 to 12 years age group, similar to that of adults, in a single-dose pharmacokinetic study of 13 pediatric volunteers aged between 8 and 12 years, given 10 mg of Claritin syrup containing 10 mg loratadine. The range of individual subject value of pharmacokinetic parameters, the area under curve and the maximum concentration were comparable to those following administration of 10 milligram tablets or syrup to adult volunteers. The pharmacokinetic profile of loratadine in children in the 2 to 5 years of age is similar to that of adults. In a single dose, a pharmacokinetic study of pediatric subjects of age between 2 to 5 years are given 5 ml of Claritin syrup containing 5 milligram loratadine. The range of individual subject value of pharmacokinetic parameters, area under curve and maximum concentration, were comparable to those following administration of 10 milligram tablets or a syrup to an adult volunteer or a children which is 8 years of age and older. Geriatric. In a study involving 12 healthy geriatric subjects, which is range between 66 to 78 years old, the area under curve and the peak plasma level, which is maximum concentration of both loratadine and this carboxyethoxyloratadine, were approximately 50% greater than those observed in studies. The mean elimination of half-life for the geriatric subject were 18.2 hours for loratadine and 17.5 hours, range from 11 to 38 hours for this carboethoxyloratadine, and the renal impairment in a study involving 12 subjects with a chronic renal impairment, Claritin clearance less than 30 mL per minute. Both the area under curve and the maximum concentration increased by approximately 73% for the loratadine and by 120% for this carboethoxyloratadine as compared to 6 subjects with a normal renal function. Claritin clearance is clearance is greater than 80 mL per minute. The mean elimination half-life of loratadine 7.6 hours and this carboethoxy is loratadine is 23.9 hours, were not substantially different from that observed in normal subjects. Hemodialysis does not have an effect on the pharmacokinetic of loratadine or this carboxyethoxyloratadine in a subject with a chronic renal impairment. Hepatic impairment. In 7 patients with a chronic liver disease, the area under curve and the concentration maximum of loratadine was doubled, while the pharmacokinetic profile of this carboxyethoxyloratadine was not substantially different from that observed in the other trial enrolling normal subjects. The elimination half-lives for the loratadine and this carboethoxyloratadine were 24 hours and 37 hours respectively, and increased with increasing severity of the liver disease.